Uh, Good evening, sir. Good evening, friends. Welcome to this session on the eGurukul platform, where we are supposed to discuss some doubt topics. Whatever doubts you had regarding ENT, we're supposed to discuss all that in this session. So, if you have any doubts, you can ask live, or else I have few MCQs prepared for you. I'll discuss those MCQs that are prepared for you guys. I'm your ENT faculty, Dr. Sanjay Aggarwal, and the platform, of course, you know, is eGurukul of DBMCI, isn't it? So I welcome you once again to this platform, and let's start. So once again, I'll wait for a few minutes or seconds in case you have a doubt. So I have prepared few very simple questions of ENT, and try to they are simple questions, not very difficult. Try to answer them. They are new questions I prepared especially for this few sessions. And in the meanwhile, if you have any doubts, you can keep asking so that I can answer your questions. So the first question is this: pyramid is present on which wall of the middle ear? Try to answer these questions along with, so that you know, is it on the anterior wall, posterior wall, medial wall, or lateral wall? Pyramid in the middle ear is present on which wall? Any idea, guys? Which wall is pyramid on? We all know middle ear has 6 boundaries, and middle ear is divided into 3 compartments, 3 boundaries and 6 boundaries and 3 compartments, and there are 3 ossicles which are the main content. Other than that, there are few things in the middle ear anatomy that you have to know, like eustachian tube. You have to know about facial recess, sinus tympani, stapedius muscle, roof of the ear called tensor tympani, these things. And pyramid, of course, as Naveen rightly said, is on the posterior wall, not on the anterior wall, Naveen, on the posterior wall. Right. Anterior wall, the main structure on the anterior wall is the eustachian tube. Eustachian tube is present on the anterior wall. Posterior wall is pyramid, and from the pyramid originates the muscle called stapedius muscle. And what does the stapedius muscle do? It produces a reflex called acoustic reflex. An acoustic reflex in turn does what? It dampens the loud sound. Acoustic reflex dampens. That means when the sound is very loud, it will decrease the loudness of the sound, because loud sound can be dangerous. Yes, okay. And outer wall is tympanic membrane. So everything that you know about tympanic membrane is applicable to the outer wall of the middle ear. So outer wall is tympanic membrane. Okay. So this is your first question. Question number 2. Now this one is an interesting question. Which of the following glands does not receive parasympathetic supply from the facial nerve? Or you can add preganglionic parasympathetic. Preganglionic. That's if you want to add, otherwise also it's a correct answer. Which of the following gland does not receive parasympathetic or preganglionic parasympathetic from the facial nerve? Is it the lacrimal gland, submandibular gland, sublingual gland, or parotid gland? So try to answer this question, guys. Let's see. I'm waiting for your answer. Sai Kiran says A, Lacrimal gland. Anybody else wants to answer this question? No one? Okay. The correct answer is D. Parotid. Parotid gland does not receive the supply from the facial nerve. See, facial nerve has 4 types of fiber. Facial nerve has 4 types of fiber. One is paraganglionic, parasympathetic. This is the one that we are talking about. And then motor fiber, which are the main fibers, taste fiber, and general sensory fiber. Now, parasympathetic supplies 3 major glands. It supplies a lot of minor glands. We are not talking about the minor glands, but 3 major glands: lacrimal gland, then submandibular gland, and sublingual gland. Of course, these are all preganglionic because post-ganglionic fibers of parasympathetic is always carried by a branch of the trigeminal nerve. It has to be the post-ganglionic fiber will have to be one of the branch of the trigeminal, right? So these are the 3, and lacrimal gland receives the supply from a branch of the facial nerve called greater superficial petrosal nerve. Now, greater superficial petrosal nerve is the first branch of the facial nerve, and this is the one that supplies the lacrimal gland, whereas these 2 glands, they receive the preganglionic parasympathetic from which branch of the facial nerve? From chorda tympani. Chorda tympani supplies the preganglionic parasympathetic facial nerve, and these are all branches of the facial nerve. Parotid, on the other hand, receives the preganglionic parasympathetic from the 9th nerve. This is from the 9th nerve, glossopharyngeal nerve. So D becomes the correct answer in this particular case, right? So very interesting question, and it's a very popular question also. The same thing, the same information that I've given you in this slide, they keep getting asked in different format, different way. They'll twist the question, they'll change the language of the question, but the basic concept, the basic points remains the same. So please be very, very sure about what I've just told you, all these things. Next one, a 56-year-old diabetic presented with ear discharge, pain and granulations in the external auditory canal. Which of the following is true of this patient? Caused by Pseudomonas, drug of choice is cephalosporins, refractory disease, all are true. So first of all, what is your diagnosis? A diabetic beyond middle age, diabetic with granulation in the external auditory canal is straightway diagnostic of what? This is straightway diagnostic of malignant otitis externa. And malignant otitis externa is caused by Pseudomonas. The drug of choice is 3rd generation cephalosporin, and refractory disease means it's difficult to treat. So it is a refractory disease, it is very difficult to treat, therefore all are true. In a case of malignant otitis externa, all are true. Now this particular question, a very similar question, get asked very commonly, almost every alternate or third paper, almost 25 to 30% chance that you will get a question, very similar question. If you look at last 10 years, that almost second or third question paper has a very similar kind of a language. It's a question on malignant otitis externa, and either they'll ask you the pathogen, or they'll ask you the treatment of investigation of choice, or the drug of choice, or the complication, things like that they keep asking. So drug of choice, of course, the pathogen you know is Pseudomonas, cephalosporin 3rd generation, cephalosporin is the drug of choice, and if they ask you the main finding is this granulation in the canal, this is the main finding, and most common complication is osteitis, and the most commonly nerve involved is the facial nerve. Facial nerve involvement is the most commonly nerve involved, right? Okay. Now, before I go to the next one, there is a question from Sai Kiran that what is the medical management of BPPV, benign paroxysmal positional vertigo? What is the medical management? We all know BPPV, we do a maneuver called Apple's maneuver, but Apple's maneuver is not a medical treatment. The question is what is medical? Now, problem with BPPV is that the only complaint is vertigo, but the vertigo is of a very short duration, less than 20 seconds, and it's very mild in intensity. So patient is not unduly disturbed by this disease. The patient work does not suffer. If the child, the child can go to school, adult can go to office, they work. It does not disturb too much, but because it is a recurrent problem, it happens every time the patient changes the neck position or turns the head. There is a very mild and very short duration vertigo. So it disturbs a lot. Now, the only drug that you can give is anti-vertigo drug. And anti-vertigo, most of them are antihistaminic drugs. They belong under the category of histaminic drug, not antihistaminic, histaminic drug. So there is a very long list of sinaragine, beta-histidine, and a lot of drugs. But in BPPV, these drugs are not very useful. They are not very beneficial, and therefore in most cases we don't give medical treatment. In BPPV, only if the patient is disturbed, sometimes for a short duration of time, we can give anti-vertigo drug. But by and large, in BPPV, anti-vertigo drugs are not useful. They are not prescribed. Usually, we try to do maneuvers like Apple's maneuver, and there are other surgical procedures also, but no medical treatment as such. Like I said, anti-vertigo can be tried, but it's not a very good option, right? Let's go on to the next question. An 8-year-old child presented with bilateral hearing loss, no pain, fever, or otorrhea, most likely diagnosis. Another very interesting question. Is it ASOM, SOM, safe CSOM, or unsafe CSOM? What is the diagnosis? 8-year-old child with bilateral hearing loss, no pain, no fever, no ear discharge. Most likely diagnosis. Let's see. What is the answer? ASOM, SOM, safe CSOM, unsafe CSOM. Anybody wants to answer this question? Okay. Let me give you a table that will be very helpful to you. Now, if a patient of otitis media, see, listen to this very carefully, okay? A patient of otitis media will always complain of hearing loss. Hearing loss will always be a complaint. In fact, any ear disease, or I say most ear diseases, hearing loss will be one of the complaints. So when this, and you know it is otitis media, suppose you know it is otitis media, and the patient comes and tells you I have a hearing loss, it gives you no other clue. Every type of otitis media will have hearing loss. So you are waiting for one more symptom. What is the next thing the patient is going to tell you? If the patient has no other symptom, the patient may have discharge from ear, or patient may have pain in the ear. Pain plus minus fever also. With pain, sometimes fever comes. Now, if it is no other symptom, then most likely it is going to be SOM, serous otitis media, or glue ear as it is sometimes called. It is pain and fever, it is ASO, acute suppurative otitis media. Now, if it is discharge, you have to know what type of discharge. Is it purulent discharge or watery discharge? If the discharge is watery, then tuberculosis is a very likely diagnosis, TB. But if it is purulent, then you have to know pus. Purulent means pus. Is it foul smell or no smell? foul smell or no smell? So I told you that this is tuberculosis. If it is foul smelling, then it is unsafe CSOM. And if there is no smell, it is safe CSOM. Now, by and large, this particular chart will help you to arrive at a conclusion or diagnosis if a patient of otitis media comes with hearing loss. Right. So try and remember this. If they give you a clinical question like this, then if you remember this kind of a table, it's not 100% true, because you might have something conflicting, like sometimes purulent discharge can be seen in ASM also. ASM can also have a discharge in the later stage, the last stage, which is called the resolution stage. It is a possibility, but by and large what I have told you is true. So see, there is hearing loss. In this case, there is hearing loss, isn't it? No pain, fever, otorrhea. So no discharge, no pain, no fever. That means no other symptom. There is no other symptom, and therefore it has to be what? Serous otitis media, isn't it? It has to be serous otitis media. So B is the correct answer. Okay, a lot of you got B. Sai Kiran got it correct, Fatima got it correct, Chandra Bhavani got it correct. So you know this already. But once again, I reiterate that please note this table, this chart that I have given you. It can be very, very helpful if you get a question like this. Just look at it at the last moment before you go for the exam. It should be very useful for you. Okay. Should we proceed to the next question? Which of the following test maneuver is being done? Is it Appley's maneuver? Is it fistula test? Is it Rose positioning? Is it this Hellpike maneuver? This one is simple. I am sure most of you will know this because it's a very popular kind of a question, isn't it? It's a very popular kind of a question. So most of you should be able to make a diagnosis with this one. Which of the following test maneuver is being done? I'm waiting for your answers, guys. Appley's maneuver, fistula test, Rose positioning, Dix Hellpike. Yes, Sai Kiran, Dr. Strange, Fatima, they've all answered D. Naveen says A, Divya says D, Sai Kiran diagnostic, yes, and Dr. Nasira says D. So if so many have marked D, D is indeed a correct answer. D it is. As Sai Kiran rightly said, it is diagnostic test. Diagnostic for what? Diagnostic for BPPV of posterior canal. It is diagnostic test for BPPV of the posterior canal. Very good, Nasira said diagnostic, correct. And Appley's is for treatment of BPPV. Appley's is done for treatment of BPPV. The image of Appley's is also very important, so please look up at the image. If you have a eGurukul app, you can go and look at the chapter. All the images are given there. A lot of images in ENT. I can vouch that all the important images are given in your app. So if you have an eGurukul app, you have no problem. You can just go through all the important images. But these two images, Appley's as well as this Hellpike, are very common. For fistula test, we have to use an instrument, and that instrument is called Siegel's speculum. And again, you have to be able to identify the Siegel's speculum. Again, this image is given in the eGurukul app, I said. And Rose positioning is a positioning done for tonsillectomy. It is for tonsillectomy surgery. And once again, in the eGurukul app, on the topic of tonsillectomy, I have shown you the image of Rose position also. So all the four are different kind of conditions for different diseases, but I have shown you image in the eGurukul for all of them, right? Yeah. So Sai Kiran has a question: how many times a patient must do the test for relief? I think you are talking about this Appley's maneuver. How many times the patient must do for relief? Only one should be enough. In most cases, only one should be enough. It varies from person to person. More important than the number of time is the gap. Because Appley's maneuver has many steps. You turn the head like this, and then body like this, and like there are 4 or 5 steps. You have to wait after you you attain a particular position, you have to remain in that position for a few minutes, 1-2 minutes, and that is more important. How much time you give to each steps, that is more important than the number of cycles. Although when we show the image, we show cyclical, the images are usually cyclical like this, but it is not always true that you have to go for cycles. In most cases, like I said, only one time should be sufficient, and recurrence happens after a few months, maybe a year. Recurrence can happen, but that particular episode will get treated with one cycle of app placement word. Dix Helpike is always done once only. You don't repeat it, because these are fatigable. Vertigo, see, vertigo and nystagmus, there are two causes. One is peripheral cause, you must be knowing all this. The other is central cause. Peripheral means ear, and vertigo due to ear has is fatigable. Fatigable means you cannot repeat it. It gets tired. If you do once, and if you try to do second time, it may happen second time, but third time it will not happen. You will get tired, fatigued. But this one is not fatigable. You can do any number of times. So because it is ear, we are talking about ear, and therefore it is fatigable, and so Dix Helpike cannot be repeated. It should be done once, but Applice can be repeated because it's not a treatment. It's not a diagnostic, it is a treatment. So you can do it more than once also. I hope that clarifies. But again, it gives me an opportunity to remind you that difference between peripheral vertigo and central vertigo could be a very important point. This is discussed in medicine also, ENT also. So again, it's given in eGurukul app if you are interested in the chapter of fistula test or caloric test. It's given there. So you can go and check. All the important difference between these two types of vertigo has been mentioned very clearly there with a table. So you can go and look at that. But what we will do is we'll jump on to the next question. You see the next question? A patient was undergoing treatment for colostoma and awaiting mastoidectomy surgery. He presented with vertigo and nausea, most likely diagnosis. Lateral sinus thrombosis, temporal lobe abscess, mastoiditis, and labyrinthine fistula. The patient was having colostoma and was waiting for the surgery, but before the surgery could be done, a complication happens, and the person began to, because of the complication, the patient begins to have vertigo and nausea. So most likely diagnosis. Lateral sinus thrombosis, temporal lobe abscess, mastoiditis, labyrinthine fistula. What is your correct answer, guys and girls? Please answer. Sai Kiran says D. Dr. Strange says D. Anybody else wants to answer this question? I'm still waiting for Naveen says D. Anybody else wants to answer? Indeed, D. It is D. So if the patient is unsafe CSOM, which is colostoma, Fatima says D, Chandra Bhavani says D, all are correct. Everybody is correct. Right. If the patient, Mohsin Sheikh says A, no. And this patient begins to have fever, or this patient may start having vertigo. If the patient has fever, most likely it is intracranial complication. Most likely there is an intracranial complication. Example, meningitis. And lateral sinus thrombosis. Lateral sinus thrombosis will have Pickett-French fever. Pickett-French fever, a fever that rises and falls every few hours. But if the patient of unsafe CSOM begins to have vertigo, then more commonly it is labyrinthine fistula, this is the most common. So obviously labyrinthine fistula has to be correct answer in this case. Less commonly, rarely, it could be a posterior cranial fossa abscess. Abscess in the posterior cranial fossa can also give rise to vertigo, because posterior cranial fossa has a brain stem with cerebellum, you know. So if you disturb the cerebellum or the brain stem, then chances of vertigo is there. But it is a very uncommon complication. Most likely it is labyrinthine fistula. As it is in the choices, this one is not given the choice. So if there is vertigo, you have to look for one of the two things. The second one is rare. As it is, it's not given the choices. So the only option left for us in this particular case is D, labyrinthine fistula. Right. Okay. Now, the most important complication of unsafe CSOM, they ask you about labyrinthine fistula very commonly, because they have signs in this. There is Gray Singer sign, Tobey Ayer sign, Crow Beck sign, Delta sign. A lot of signs are there, and that's why it is important. And Grady-Negos syndrome is another important complication they ask in the exam, because Grady-Negos syndrome has 3 Ds. It has 3 Ds, DDD, discharge, deep pain, diplopia. And about labyrinthine fistula also, they ask you questions like this one is about labyrinthine fistula, and mastoiditis. Mastoiditis actually is the most common complication of unsafe CSOM, and there were a lot of questions. Again, there are a lot of findings in this way: iron out mastoid, lighthouse sign, reservoir sign, things like that. Sometimes they ask you about this lateral sinus thrombosis. Okay. So this will complete the main points about the complications of CSOM, but we'll go on to next question. Type 3 tympanoplasty is a surgery for CSOM. All are true except, that means 3 are true, 1 is false. You have to pick up the false point. So which is not true in this case. Graft is placed on the foot plate of stapes in type 3. Type 3 is also called columellar surgery, also called stepidomeringopexy, is a relatively common type of tympanoplasty. Yes, Dr. Strange, petrositis causes Grady-Negos syndrome. I'll go back that. Petrositis is the one that causes Grady-Negos syndrome. So since I said Grady-Negos syndrome, it includes petrositis in that also. But coming back to this particular question, which is not true. Saikaran says D, type 3 tympanoplasty is a surgery for CSOM. All are true about this except. Fatima also says D. Srijan Kumar says B. Anybody else wants to answer this question? Type 3 tympanoplasty, guys, is a very popular tympanoplasty from the exam point of view. Akash says D, Srijan says B, Mahendra says A, Dr. Strange says B, and Dr. Nasira says A, Thasni Pularat says A. So A is the correct answer. So Mahendra, Nasira and Thasni, you have got it right when you say A. In type 3 tympanoplasty, the graft is placed over the head of stapes. It is placed over the head of stapes, not over the foot plate of stapes. That's not true. So on the head of stapes. The rest of the 3 are true. That it is called columella. Actually, this is a very popular name and a very important MCQ. They ask you very commonly what is columellar surgery. Columellar surgery is the other name for type 3 tympanoplasty. A very, very popular name. It is also called stapedom. See, there is a joint between stapes and graft is called meringus. Pexy means joint. So there is a joint between the stapes and meringus, stepidomeringopexy. And out of all the types of tympanoplasty, 1, 2 and 3 are relatively common. 4 and 5 are very uncommon. So it is a relatively common type of tympanoplasty. It's pretty common actually. Okay. Now out of the surgeries of the middle ear, tympanoplasty and stapedectomy surgery, dotomy let's say, are the most popular surgery from the exam point of view. They ask you tympanoplasty because there are 5 types, so there are a lot of questions possible. Stepedotomy. Less commonly they can ask you questions from myringotomy, myringoplasty, then mastoidectomy, myringotomy with grommet insertion, myringotomy with grommet insertion, myringoplasty, and mastoidectomy also sometimes they can ask you. But these 2 are easily the most important surgeries that they ask you questions from. Right, very, very important. Okay, so next one. Which of the following is true of glomus tumor? Glomus tumor is a tumor of the middle ear, is a paraganglioma, SWOT sign is seen, biopsy should be done to confirm, and radiotherapy is the treatment of choice. So let's see, guys and girls, what do you say? Which of the following is true about glomus tumor? So 1 is correct and 3 are not correct. So you have to pick up the correct answer. Anybody wants to say something? Answer this question. Okay, Srijan Kumar says A. Kiran also says A. Tasni says A. Mohsin says B. Srijan Kumar paraganglioma. Yeah, Fatima says A. Mahendra says A. Strain says A. Nasira says B. So a lot of A's in this, and A indeed is the correct answer. Glomus tumor is a type of paraganglioma. It belongs to a paraganglioma. There are two types of paraganglioma. One is glomus tumor and the other paraganglioma is chemodectoma. Chemodectoma is also a type of paraganglioma. SWOT sign is seen in otosclerosis. A lot of people answered SWOT sign. This is a feature of otosclerosis. And SWOT sign is seen in otosclerosis. So not true for glomus tumor. And because glomus tumor is a vascular tumor, it's a vascular tumor, and that's why if you take a biopsy, then the patient may have a lot of bleeding. Bleeding may be a problem, and that's why biopsy is contraindicated, and surgery, most of the benign tumors, surgery is the treatment of choice. You can do radiotherapy if surgery is not possible. Radiotherapy is pretty commonly done, but it's not the treatment of choice. Treatment of choice is surgery. Okay. So this is about glomus tumor, and about glomus tumor they ask you that signs. There are 4 signs in glomus tumor. One is this presentation. Glomus tumor presents as something called pulsatile tinnitus. Pulsatile tinnitus. And signs like Gray-Singer sign, Tobe air sign, no sorry, my mistake. Signs like rising sun sign, Brown sign, Phelps sign, and Aquino sign. Right. So these are the 5 names in glomus tumor, which are the most important thing they ask you from the exam point of view. So remember this, very, very important. Glomus tumor and another tumor they ask you questions on is acoustic neuroma. Acoustic neuroma is another important tumor they ask you questions from. So we'll go on to the next question and talk about a 32-year-old pregnant lady presented with hearing loss in the right ear for a few weeks. Which of the following feature may be true in this patient? Renage is positive Renage test. Vibration lateralized to the left side. Cahart's notch may be seen. All are true. So obviously you have to first make a diagnosis and then maybe answer this question. A 30-year-old pregnant lady presented with hearing loss in the right ear for a few weeks. Which of the following features may be true in this patient? Positive Renage test. Vibration lateralized to the left side. Cahart's notch may be seen. Yes, Srikant. This is otosclerosis of right side. Otosclerosis of right side. And in otosclerosis, the patient has conductive hearing loss. In conductive hearing loss, Weber's Rennes is negative. Negative should be negative, so this is not true. And Weber's lateral to the same side. Weber's gets lateral to the same side, so it should be right side, not the left side. So this is not true. So this cannot be true. Cahart's notch is the correct answer. So C is the correct answer. Most of you got it correct, isn't it? So we have, I think, Dr. Strange says C, Fatima says C, Sai Kiran says otosclerosis is true, Nasira says C, true, and Nasira says otosclerosis, yes, Fatima says otosclerosis, yes, Exita says otosclerosis, yes, Mohsin otosclerosis, yes, not D, it worsens in pregnancy, correct. Cahart's notch, we all know, is a sudden dip. It is sudden dip at 2000 hertz in bony conduction audiogram, isn't it? This is what is Cahart's notch, sudden dip at 2000 hertz in the bony conduction audiogram. Very, very important. Investigation of choice for otosclerosis is tympanometry. Can you tell me what type of tympanogram do we expect in this patient? Very simple question, very popular question. What type of tympanogram do you expect in a patient of otosclerosis if we do a tympanometry? Anybody wants to answer that? AS type. This is the most important finding and is diagnostic of this condition. Yes, AS. AS. Very good. Otosclerosis is a very popular disease. There are so many questions: the site, the cause, the kind of person, like pregnant lady it is seen in, then finding of Rennes, Weber's, Swabeck's, audiometry, tympanometry findings. Then there is a syndrome called Van der Hoef syndrome. About treatment, stapedectomy, sodium fluoride drug. So a lot of questions are possible from otosclerosis. Everybody must raise this topic very, very nicely. It's a very simple topic, but the questions are very, very frequently asked. And I'll tell you that in otosclerosis, most people get it right all the time. Most of the questions people get it right. So there is no reason that you should not get it right. So do it very nicely. But we will go on to the next very popular question. The X-ray of the patient is shown who presented with high-grade fever, dyspnea, cyanosis and dysphagia. The X-ray finding is shown. What sign is this? Steeple sign, sword sign, cherry red epiglottis and thumb sign. What is it? It's very simple, isn't it? Look at the arrow and try to answer this question. Look at the arrow and try to answer this particular question. Srijan says D, Ankita says it is thumb sign, yes. Mohsin says D, Fatima says D, Akash says D, Dr. Nasira says it is epiglottitis D, Srijan says epiglottitis, Vinita says D, yes, D it is. This is a thumb sign, and like you rightly said, it is seen in acute epiglottitis. And this is an X-ray finding. Cherry red epiglottis is also seen in acute epiglottitis. Remember this. And this is seen on laryngoscopy. So both these signs are in epiglottitis, cherry red epiglottis as well as thumb sign, both are seen in epiglottitis, but one is laryngoscopy, one is X-ray. And this sign is also called sometimes, rising sun sign. It is sometimes called rising sun sign. So rising sun sign in ENT can be seen in two diseases. We have done both. It can be seen in Glomus tumor. It can be seen in acute epiglottitis. But they are different. Glomus tumor is a rising sun sign in the ear, and epiglottitis rising sun sign is in the throat. Swart sign we just discussed is seen in otosclerosis, and steeple sign is seen in croup. Steeple sign is also a very popular MCQ. In fact, last year in NEET PG they had asked about steeple sign. Those who wrote last year's NEET PG or those who are solving last year's MCQs will know that they had asked steeple sign last year. So it's a very popular sign. It was not an image based question last year, but they can give you the image also. Both these images are very important. But interesting thing that I find here is that there are two rising sun sign in ENT. So that can be interesting sometimes. Yes, Nasira says that croup is caused by a para-influenza virus. Absolutely correct. True. Okay. A patient of 75 years of age began to have hearing loss in both the ears. Otoscopy was normal. Which of the following may be a finding in this patient? So which is true in this patient? Renies will be positive in both the ears. Weber's will lateralize to better side. Tympanometry is the best investigation and will improve with age. So what is your correct answer? Thank you, Ganesh. In the exam also they will give you clear images, because they know that undergrad students, they are not very used to seeing images, x-rays and all. So exam usually they give you good images, but I'll tell you something. Last few years they have been giving images from the middle ear anatomy. They are showing middle ear anatomy images, and those images are very, very poor images. Very poor images. Yes. So what is the diagnosis? Everybody got it right. SNHL, Nasir says SNHL, Ganesh says A, Nasira says A, Awana says A, Fatima says A, Strain says A, Ankita says A, Vinita says A. A. This is presbycusis. The disease is presbycusis, which means senile deafness. What is senile deafness? Deafness due to old age, hearing loss due to old age. Akshita says A, Thasmi says A. A is the correct answer, and it is usually bilateral because age will affect both the ears. And presbycusis, which is age related hearing loss, is often sensory neural hearing loss. It causes sensory neural hearing loss both the ears, and therefore Renes will be positive in both the ears. This is also true actually. In SNHL, Weber's goes to the better side. So there is a printing mistake here, but both A and B are equally important. Both are correct answer. Tympanometry is only for middle ear. This is inner ear disease. Tympanometry is done for middle ear, so not for inner ear. Yes, Ganesh, you are right. Tympanometry. Middle ear is called tympanum. The other name for middle is tympanum, and metry is investigation of the middle ear is tympanometry, and presbycusis affects the inner ear. So A and B both are correct. So those who mark A will get full marks. Those who mark B will also get full marks. If this kind of a mistake is there and you are supposed to pick up one answer only, then you get both will give you correct marks. So this is kind of printing mistakes. They don't happen in the exam. Yeah, in the class, because we are not very careful sometimes, it can happen, but in the exam they will not happen. The receptor population decreases, and that is irreversible, so won't improve with age. Absolutely correct. There is a permanent damage of the whatever hair cells or receptor, whatever is there, and so it worsens with age. Any disease which is due to old age, with age it will worsen. Graying of hair will become more and more gray. Cataract will become more and more severe cataract. Hearing loss will become more and more severe. So anything that happens due to age will worsen with age, not improve with age. We understand this. Then, which of the following may be a feature of Meniere's disease? Hyperacusis, presbycusis, diploacusis, and paracusis. Which of the following may be a feature of Meniere's disease? So what do you think? hyperacusis, presbycusis, diploacusis and paracusis? Answer guys. Let's see. What do you see? Fatima says C. Chandra says C. Nasira says C. Avana says C. Mohsin says C. Akash says C. Hanuman says C. Akshita says C. C it is. C. Everybody, yeah. Ganesh C. Vinita C. Srijan C. Srijan says A. No. Hyperacusis is due to absent stapedial reflex. When the stapedial reflex is absent, that condition is called hyperacusis. Presbycusis we just discussed, it is senile deafness. And paracusis, which is also called paracusis, we will see, is a feature of otosclerosis. So diploacusis is a feature of Meniere's disease, which means a double sound. Everything that you speak, patient hears, loud sound becomes more loud. In hyperacusis, Mohsin, is that hyperacusis you are talking about? If it is hyperacusis, yes, correct. Loud sound becomes more loud. True. Okay. So because there is acusis in all of them, so sometimes one tends to get confused, but these are very popular from the exam point of view. They ask you very commonly, so try to remember all these things. Okay. We'll go to the next one. Which of the following surgery is done for Meniere's disease? Portman's surgery, intratympanic gentamicin surgery, vestibulectomy, all. Which of the following surgeries is done for Meniere's disease? Portman's surgery, intratympanic gentamicin, vestibulectomy, all. Yes, Mohsin, you are right that paracusis is hearing gets better in noisy area. That is true. Yes, in Meniere's, Ganesh is right that there is hearing loss, particularly in the lower frequency. That is absolutely correct. All have answered D, right from Afez to Hanuman to Srijan, Athira, Avana, Srijan, Fatima, Ankita, Hanuman, Tej, Ganesh. Everybody has been able to answer it correctly. Portman's surgery is also called endolymphatic sac decompression. Sac decompression, it is correct. And in this there is a landmark. Anybody who can tell me, in a Portman surgery which is called endolymphatic sac decompression, there is a landmark for endolymphatic sac. Anybody knows that name of the landmark for endolymphatic sac, which is a surgery done for Meniere's disease? Anybody wants to name that landmark? Yes, Ganesh is absolutely right. He says that because Meniere's is a unilateral disease usually, that's why if the vertigo becomes too disturbing, we can sacrifice the ear and we can retain only one ear. That is true. Yes, Srijan says Donaldson's line, Ankita says Donaldson's line, Hanuman, not Dorman, I think you printing mistake hua, typing mistake. Yes, Donaldson's line. Donaldson's line, very good. Donaldson's line, absolutely right. And intratympanic gentamicin surgery is also called chemical vestibulectomy. The other name for this surgery is chemical vestibulectomy. So obviously vestibulectomy can be done, and somebody says besides all the surgery we can do shunt surgery, we can do labyrinthectomy, and there is sacculotomy surgery. Then there is nerve resection, neurectomy. Nerve resection means neurectomy. These are the other surgical options for Meniere's disease. So there are a lot of options. 3 are given in the choices and the 4 more options that I have given you. So a lot of options for Meniere's disease surgery. And when you do vestibulectomy can be done by different methods. There are 3 methods. One of them is using chemical, and that chemical is gentamicin, and that's why it's called chemical vestibulectomy, sometimes called medical vestibulectomy. Right. So Meniere's disease is a very important. You see, already we have 2 questions from Meniere's. Which of the following is a feature of acoustic neuroma? Most commonly arises from superior vestibular nerve. Most common site is cerebellopontine angle. Is seen in neurofibromatosis type 1. All are true. So which of the following is true about acoustic neuroma? Most commonly arises from superior vestibular nerve. Most common site is cerebellopontine angle. Seen in patient with neurofibromatosis type 1, and all are true. So Srijan says B, Avana says D, Hanuman says B, Ankita says D, Ganesh says all are true, Tej D, Praveen D, B, S, Dr. A. S. Khan B, Nasira B. Anybody else wants to answer? Harry B. So Fatima B, so many are answering B. B is indeed the correct answer. B. Yes, you are right that it arises from inferior vestibular nerve more commonly. Not from the superior vestibular nerve. That is true. It arises mainly from the inferior vestibular nerve, not from the superior nerve. So this is not true. And it is seen in NF2, not in NF1. It is very commonly, you are right, Ganesh, it is seen in NF2, bilateral tumor in, yes, in NF2 it is bilateral, you are again correct. In NF2 it is bilateral, you are again right. So yeah. So see, the thing is that you know everything. If you have attended your lectures, if you have revised, there is no reason that you will not know. I'll tell you that if you have done the revision, attended your lectures, you will know 80 to 90% of the question always, you will know them. But still you will not get 80-90% marks, you will get 65-70% marks. Why? Because of silly mistakes. One of the things that makes it go silly is the nervousness. In the exam, it's a test, we are all anxious, nervous. So that is one thing you should not be. You should go to the exam with a lot of confidence, but it should not be false confident. कि पढ़ा भी नहीं है confidence जबरदस्ती का. No. If you have read, what I am saying is, if you have read, you have attended your lectures, revised and done MCQs, then you should go to the exam with a lot of confidence and keep telling yourself that because I have done the hard work, there is no reason I will not get good marks. There is no reason I will not be able to answer. But be careful, don't get trapped. Sometimes the questions looks very simple like this one, but you might get trapped very easily because you are so confident कि ये तो आता ही है मेरे को, then you don't read it properly, and that's why you should be very important. But we'll go to the next question. This one is simple, very straightforward. What procedure is being done in the image shown? Is it microscopic ear surgery, otoscopy, tympanometry or tuning for test? This one should be sitter, एकदम simple है ना, बिल्कुल बच्चों वाला. So what do you say? What is your answer? Yes, it has to be otoscopy. I don't doubt that anybody will get it wrong. Everybody will get this one right. So yeah. Otoscopy is the correct answer. B is the correct answer. I'll have to because the thing has got stuck. So 1 second guys. Next question. True of caloric test. Lateral canal is stimulated. Patient is placed in supine position and the head is raised by 60 degree. If nystagmus is seen, this suggests vestibular disease. All are true. So true about caloric test. Lateral canal is stimulated. Patient is placed in supine position and the head is raised by 60 degree. If nystagmus seen, the patient, it suggests vestibular disease. All are true. So what is your correct answer in this particular one? Avana says D. Chandra Bhavani says A. Akash says D. Hanuman D. Aksita D. Praveen D. Fatima A. Anybody else wants to answer this question? Okay. Ankita D. A is the correct answer. A is the correct answer. The patient is made to lie down supine and the head is raised by 30 degree, not 60 degree. During the caloric test, the head is raised by 30. The water used is also 30 degree and the head position is also 30 degree. So 30 degree is the correct answer, not 60. And every time you do caloric test, every patient will have nystagmus, whether it is normal patient or vestibular disease patient. Every patient, if you do a caloric, every person actually, if you do a caloric test, will have nystagmus. What varies is the duration, because we do nystagmus 4 times. Once we do nystagmus in the right ear with 44 degree, once we do nystagmus in the left ear with 44 degree, then we do nystagmus in the other ear with 30 degree, and then we repeat with 30 degree on the opposite side. So 44 degree, 30 degree in the right ear and the left ear, 4 times we do nystagmus, and then we see that the duration of the nystagmus, each of them, the duration is more important, and that's based on the duration we are able to make a diagnosis. So duration is more important than whether nystagmus is present. Nystagmus, like I said, will be there always. Okay, there is no absent nystagmus. You will never have an absent nystagmus unless you have completely labyrinth is removed. If you remove the labyrinth, then maybe, otherwise there will be nystagmus always. Next question. The electrodes of cochlear implant is placed in which of the following compartment of the cochlea? Again, a very simple question, straightforward. Scala vestibuli, scala media, scala tympani on basilar membrane. So where do you place the electrodes of cochlear implant in a cochlea? Which compartment of the cochlea? Vestibuli, media, tympani, or on the basilar membrane? Very simple, straightforward. I am pretty sure that everybody is going to get this right. Yeah. Hanuman says C, Ankita C, Dr. C, Suzanne B, Nasira C, Vinita C, Ganesh C, Mohsin C. Yes, C it is. C is the correct answer. In scala tympani, through which window? In scala tympani, through round window. So this is another question they ask you, which is the route that is used for a cochlear implant, and like I said, the route is the round window and the compartment is the scala tympani. Both are very, very important questions. So there are a lot of questions. There is no end to the questions we can do, but today's time is up. So we shall stop it here today. I hope this session was useful to you guys. We might have similar questions, similar sessions. If you are interested, you can contact the admin department, and maybe we can have another session of doubt solving. Today, if you have noticed, we have talked about only the ear questions. We have done ear questions from ear only, but of course I have questions from the throat and the nose as well, but time is a limiting factor. This much time we had for today. So I thank you for joining today and participating. Best of luck, guys. I really hope that you guys, there is a lot of dilemma. I'm sure you guys are under a lot of stress because of uncertainty there that we have been having for the last few times. We don't know कि ऊंट किस करवट बैठेगा, it's like that. Postpone होगा कि नहीं होगा. Ganesh says near round window. So you said it is not exactly round window, it is near round window. You are right, Ganesh, that it is not exactly round window, it's near round window, but round window is accepted as a correct answer. You are right. Round window, it's not exactly round window, it is near round window, but round window is accepted as a correct answer. So guys, best of luck. I really hope that you guys do very well so that you get the subject of your choice and the college of your choice. But don't get disturbed by this news that is coming along. ये तो चलता रहेगा. This part and parcel of the life. Every stage in life you'll have such problems, uncertainties. आपको तो एक ही काम करना, पढ़ना है. You keep studying. There is no other option you have. So please keep studying, and I'm sure that you'll be able to do very, very well. Okay. So once again, good night, God bless, and see you later.